There is a large variety of causes of recurrent miscarriage. Frustratingly, the most common thing we find with couples is that we don't actually find a reason. More than 50% of recurrent miscarriages, we can't actually identify why the miscarriages continue to happen. The largest group of known causes of recurrent miscarriage are chromosomal abnormalities. That's either chromosomal abnormalities in either of the parents, such as a translocation, or recurrent chromosomal abnormalities in the embryos, and most commonly that happens as a woman ages. The second largest group are anatomical abnormalities, so abnormalities to the womb. This could be a fibroid that is impacting on the cavity, a polyp, or even a Müllerian anomaly where there has been a developmental abnormality in the uterus itself. And some of those are fixable and some of those are not. Another large group are the hormonal causes. This could be abnormally high prolactin levels, the imbalances that can occur with polycystic ovarian syndrome, and even glucose intolerance or insulin resistance can increase the chances of a miscarriage or recurrent miscarriage. Another large group are the clotting abnormalities, the heritable thrombophilias, things like prothrombin gene mutation or factor V Leiden have been associated with recurrent miscarriage. The largest group within that is antiphospholipid syndrome. And if a woman has been identified as having antiphospholipid syndrome, it's important for her to discuss this with her fertility specialist, as it not only has implications for recurrent miscarriage, but also late pregnancy outcomes as well. There is the potential for male factor with a high DNA fragmentation or oxidative stress within the sperm. And then there's a large group of possible things that can lead to recurrent miscarriage, though these have low levels of evidence, such as exposure to endocrine disruptors, toxins, makeup and even hair dyes has been associated with recurrent miscarriage, though the quality of the evidence behind these things is quite low.